Good morning, everyone. It is truly inspiring to introduce today's speaker, Dr. Preeti KS. She is working as an assistant professor at JSS Institute of Naturopathy and Yogic Sciences and is heading the Department of Forensic Medicine. Dr. Preeti has around 8 years of experience in the field of naturopathy and yogic sciences, contributing actively to academics, patients' care, and health education. On behalf of yesterday's World Hypertension Day, she will be delivering a wonderful and insightful talk on hypertension, its causes, prevention, and natural method that can be effectively implemented in managing and handling hypertension throughout lifestyle modifications, naturopathy, and yogic practices. I'm sure today's session will be highly informative and beneficial for everyone. Over to you, ma'am.
Thank you, Dr. Arya, for the one warm invite. So, first of all, good morning to all. I'm here, Dr. Preeti, today for delivering a health talk on World Hypertension Day. The day called yesterday, May 17, the Awareness Day. So, coming over to then overview on World Hypertension Day. So, basically, why hypertension and why awareness? Why hypertension is because of its serious increase in the number of people falling into or incidenting into the disease hypertension. So past 20-25 years have seen a profound increase in patients who has been reported with increase in their blood pressure. Increase in their blood pressure. And why awareness? Yes, and awareness is very, very necessary in this because hypertension is a silent killer. Based or comparing among the other diseases like any fever or infection or any other particular thing, all the disease present with the presenting complaints like a high temperature or tiredness or anything. But when compared to hypertension, until and unless we feel that we have to go out and check our blood pressure, until and unless we put an initiation, then only we can understand identifying the number. Yes, my numbers are beyond the normal limit and I am under hypertension disease now. So since it is a silent killer or a silent threat to us, it is very, very important that we go forward, move forward, understand what is hypertension, treat accordingly, and stay away from deadliest diseases or very, disabling diseases in the future. So let's see an overview today in this health talk, an overview on hypertension, why hypertension, what is hypertension and what are the causes of hypertension and what are the basic steps we can identify hypertension early and how we can prevent them and so on. So let's see, measure your blood pressure, control it and live longer. So high blood pressure being a silent killer, regular checkups, not only one time checkup. So today I'm feeling lethargy or tiredness. Let me go check my BP and I'm identifying that I'm hypertensive and the doctor prescribe a medicine and yes, I'll start taking this medicine. We should not stop there. Hypertension is a disease which needs a regular checkup. Okay, so regular follow-up, regular checkup, and whether we whatever treatment we are taking are effective on us or not, to check that. So to check and eat healthy, to stay active and managing this is the key points of this health talk. So let's understand as awareness day creation. What is the reason for that? So this slide, this picture, briefly explains about the prevalence and geographical variation of hypertension in India. So let's see the geographical variation of hypertension is as such. we can see here the more prevalence is seen in the state of Punjab and Kerala, where it shows more than or equal to 47% increase in the prevalence. And also we can see in the north states as well as northeastern parts showing more prevalence. So we have to be very, so the people who are staying in those states has to be very much aware about making them aware how much is their blood pressure, and checking continuous checkups and follow-up is very, very necessary. Next, coming over to the what is a key insights and comparison of urban as well as rural. So previously in rural areas, or we can say in the remote areas of villages, in India, there was always less cases of hypertension reported. But right now, India is moving fast forward, and so our rural people are also shifting into a next generation lifestyle living. So that resulted in the 2025 report that there is a rapidly raising increased blood pressure cases in rural India too. And of course, in the urban area, the prevalence and the incidence, the number is being increasing. And 2025 report approximately 13.5 percentage of increase in the reported cases of hypertension. So rural hypertension is rapidly rising due to lifestyle transition and the national burden. So if we take the overall burden, okay, combining the urban as well as the rural, the pooled prevalence of increasing in the 27.2 percentage is being observed. That means nearly 1 in 4 adult in India have hypertension. So this is truly a disappointing information. Okay, since there has been continuous awareness on World Hypertension Day, continuous primary availability of primary health center, family health center in India. There is still incidence and prevalence of this world hypertensive cases in India. Now, let's uh, focus on this slide. This slide says that hypertension is a silent threat. So you can observe the person who is sitting in this screen looks very healthy, right? Looks healthy in the sense the appearance we can say. The person is fit, the person is not obese, the person does not have any bleeding or infections or anything. The person, the image of the person looks perfectly fit, perfectly okay, perfectly normal. But let's try to understand the background of the image. We can now see the person is sitting in an tensed environment, okay, where the person is very much tensed and continuous tensing thoughts and tension, stress hormones are still in building in his system. The blood is creating so much amount of stress hormones and all presently in his body. So the hypertension doesn't make any noise, doesn't make any signs, but slowly, the degree of tension increases in the body, and we will not feel any symptoms. We will not feel any this thing. We will not feel. So when we feel bleeding in our hands, we immediately rush ourselves to hospital and we will cover the wound. But hypertension is as such, there is nothing visible outside. Okay. Until and unless it leads to a stroke or a heart attack or a kidney failure or anything, we identify that we were living with hypertension or we were living with increased blood pressure. How to prevent that? Of course, we can do a regular checkup and we can save our life. So, okay, we have identified that it's a sleeping disease or a silent threat. Now let's understand what is a blood pressure. So normally our human body is supplying blood. Okay, from the heart, blood is being pumped into the required organs throughout the body through blood vessels. So when the blood is being pumped into the heart is pumping the blood into the blood vessels. Pumping creates a pressure, and that pressure is called as the blood pressure. So whenever we get a reading called as 120 by 80, so that is a blood pressure reading which shows systolic as well as diastolic. So systolic is the blood pressure actively happening when the heart is pumping the blood, and diastolic is the period where the heart relaxes in between the pumping and sharing. So this 120 by 80 is a reported normal value, where above this or below this is called as hypo or hypertensive. So why it matters? High blood pressure can damage your arteries and organs. So normally what happens when we go into a hypertension, the blood which is being pumped, if there is an increased volume of blood or if there is a presence of unwanted toxins, so we can term it as inflammation. What happens is that there is an increased push apart from the heart pressure, there is an increased push into the arterial walls. So an increased push in the beginning and all, it will be very silent. It will be compensated by our body. But this push, if it goes beyond a level for an increased period of time, causes damage to the blood vessels and reduces the blood supply to the organs, and that's marks the beginning of diseases in our body. So here what happens, the blood heart itself gets reduced supply of blood, and it can lead to heart disease. Sometimes what happens, increased pressure for a longer period reduces the blood supply to our brain, which causes stroke. Reduced blood supply to our kidney, which leads to the failure of kidney, and hence can result, following all this reduced blood supply, other serious conditions can also result. So this is where we can identify when we go out and check our blood pressure and we identify that our levels are beyond 120 and beyond 80, that we are hypertensive. Now let's move on to this slide, where this slide explains about few of the unhealthy habits where we choose today but will make us sick tomorrow. So let's see here, too much amount of screen time. Endless scrolling, endless screen time leads to stress and poor focus and causes mental fatigue. And let's see the next one, sedentary lifestyle. Sitting for a long hours, slowing down our body and mind. So sitting for a long hours can cause increased stress and makes our body unhealthy. Then consumption of unhealthy food. So junk food increases the weight, increases the cholesterol and disease, and makes us more risk towards hypertension. Consuming this junk food causes increased metabolic waste volume to the blood. So the blood volume plus increased metabolic waste volume causes increased pressure on the blood walls and resulting hypertension. Chronic stress. Stress in turn produces unhealthy release of stress hormones. So this amount of stress hormones along with the blood pushes the blood arterial walls, resulting in the hypertension. Next is poor sleep. So there is less sleep weakens our immunity and mood and increases the disease risk. So these all combinations of unhealthy habits which we choose today will result in the increased risk tomorrow. Now we will see this person who is sitting under a continuous stress. This continuous stress is making his system into a tension. So this person is receiving so much amount of notifications, so much amount of what to say, job related as well as familial related notifications, which in turn is releasing so much amount of stress hormones in the body. So the triggers involve work pressure, constant notifications, tight deadlines, and lack of rest. So how the body responds? The body responds by releasing cortisol as well as adrenaline. These are the key stress hormones which is being released immediately and continuously in the body. So what happens here? Heart beats faster. Cortisol and adrenaline are the two hormones which releases and says that it is a threat condition. Now our body has, the heart has to beat faster. That means the heart has to pump more blood at this point of time in order to compensate or make the person normal. So this is an additional stress which happens, an additional pumping, an additional pressure and resulting in hypertension. So what happens? The body or the person is in a continuous stress. The notifications or the work pressure or the deadlines are not a one day solution. The person is under continuous exposure, daily exposure, day by day into these. And without knowing, we are putting our body into the increased stress and resulting in hypertension. So we have learned that the continuous screen exposure and stress is one of the reason causing hypertension. And let's see what about the diet. Is diet having a role in our raising blood pressure? Of course, yes. Diet, so let's see. The basic FDA approved required dietary allowance of salt in an adult is 1500 if we want 1500 gram if we want a heart health, if we want to keep our heart healthy. So a person who is having an active physical activity as well as movement can increase their amount to 2500 grams per day. But if but to maintain, if already are in the level of hypertension at the beginning of hypertension, the required dietary element or allowance of salt is 1500 milligram. And yes, you can see if a person, if we say that, okay, I just took a meal, a fully healthy meal, but apart from the fully healthy meal, the person is choosing or choosing to take a chip or a pickle or an instant noodle or a pizza, that is adding on to a salt to the salt into the diet of the person. So high salt intake can lead to hypertension, heart disease, and stroke. How? How salt is having a role in the hypertension? Salt is the whatever salt we are taking in our body causes the kidney to retain the blood volume as well as the water volume in the body. If this blood volume and water volume is more in the body, what happens? This increased volume causes a pressure on the blood wall. Not one day of increased salt intake, a continuous days together, weeks together, months together of salt intake is having a high impact on the blood walls of the body. This pressure causes thickening of blood vessels, and what happens? Thickened blood wall will not help in the movement of blood from one place to another place. And what happens in turn? The areas or the vital organs will not get sufficient amount of blood. So if there is no sufficient amount of blood, there is poor oxygenation, and what happens? There will be reduced functioning of that particular organ. What happens if that blood volume is reduced in our brain, in our heart, in our kidney? These three organs are very vital organs of our body, and vital organs are not getting any blood supply, and its function is reduced. So that's why it is telling that until and unless a person reaches into a heart disease, reaches into a stroke, or reaches into a kidney failure, we remain unaware that our blood pressure is silently creating these many chaos in our body. Next is usage or poor sleep, binging over any particular series or binging over a particular movie and pushing our body, making our body awake during night time is automatically we are making our uh, relaxing hormone or recovery hormone or sleep hormone melatonin. So this causes a switch off to the melatonin hormone. Melatonin hormone is the one which helps our body to recover, which helps or supports the recovery mode of our body. When we sleep, the body switches into a recovery mode where all the regenerations, recycling of cell, and everything happens during this time. And melatonin is the one which gives the signal for that recovery. What happens? We are not allowing that melatonin to work properly. We are not sleeping. We are constantly under the blue light screen. And let it be 12 o'clock at the night, 1 o'clock at the night, till the next day, early morning. There is a continuous switch off to the melatonin hormone. So, how poor sleep is affecting us? Less than 6 hours of sleep is increasing the stress hormone. Not only we are switching off the melatonin hormone, we are increasing the stress hormone in our body. This reduced recycle and this thing rest, and plus additional release of stress hormone into the blood vessels, as already discussed, tightening of the blood vessels, increasing strain on the blood vessel as well as strain long term causes diseased conditions. So if we binge tonight, we have to be prepared for paying tomorrow. Late night on our phone can harm our sleep as well as raise our blood pressure. So this is a detailed explanation on sleep deprivation as well as hypertension. So we can see here normal healthy sleep. When we sleep, our restoration happens, parasympathetic recovery happens, rest and digestion state will be very normal, and our stress hormones, that is adrenaline as well as cortisol, will be having a balanced release, and nighttime blood pressure dipping will be constantly uh, in the same ratio during our sleep too. What happens when we sleep deprived? There is an hypothalamus pituitary axis overactivation, release of stress hormone, sympathetic dominance, that is making the body in a state of increased awareness. Now also the body is not under stress; it is under the fight or flight. There will be continuous vasoconstriction, tightening of the blood wall, increased blood pressure. Apart from that, this blood pressure causes injury in our blood vessels too. If there is an injury, in response to the injury, our body will release the inflammatory cytokines or inflammation. What happens if we are not recovering our body? This inflammatory cells will be continuously released without a off switch. So this inflammation is also adding on to the blood pressure, and hence we result in the hypertension. So now we have identified what is hypertension, what is a blood pressure, and I have identified few of the mistakes we do in our lifestyle which can result in the which results in the this thing uh, hypertension. Now let's understand hypertension in the view of naturopathy. So, naturopathy view health as a holistic way. Okay, if there is no rest or a reset button, or if we does not put what to say on switch for our elimination, what happens? The body goes into a high stress mode. So naturopathy is a holistic approach to health that supports body's natural ability to heal itself through harmony of body, mind, nature, and energy. So the principles of naturopathy include natural healing. We have to trust in our body to innate ability to heal. So first, whenever we are under the stress, so We are telling we are not sleeping, we are eating high salt content food, or we are inactive, or we are constant stress. When we identify that we are under the stress, and at that point of time, when we shift our consciousness to a holistic approach, detach from that stress, take a 10-minute, 5-minute break ourselves and go out and uh, identify at that point of time that there is the point where we view our body, or we shift our consciousness from stress to a healthy body. Next, naturopathy focuses on treating the root cause. So, root cause always, whenever a patient with the hypertension approaches a naturopathy physician, the root cause will be learned first, and we will try to address them. And always, we never go and treat only whatever the measures we can reduce the blood pressure. We treat the body as a whole, and we educate the patient as a whole. And always, we will educate the patient to live in harmony in a balanced and purposeful life. Not always binge watching, not always munching on a high salty diet, or not always continuous stress is the life. We have a life where we have to go out and we have to expose our body to the sunlight. We have a life where we have to expose our body to the natural elements of air, water, go out and experience the fresh air, go out and view the beauty of nature, and always identify that a balance is necessary for the body. So when stress takes over, our body has to pay over. So the stress is taking over, our body is constantly under stressing the brain, heart, digestive system, immune system. Not only hypertension, it can also result in digestive system issues too. So this is a slide which explains hypertension and the autonomic nervous system. So autonomic nervous system is a quite scientific term. Let's make into a simpler term. The autonomic nervous system is a parasympathetic as well as complementary system, that is parasympathetic as well as sympathetic. The autonomic nervous system always maintains a balance between these two systems. First system is all about rest and digestion. Second system is all about fighting and flight, fighting or in the flight system. And this is the system which regulates the blood pressure. So whenever the body is signaling that there is increased heart rate, there is increased constriction of blood vessel, there is an increased renin, automatically the body sends a signal that we have to fight it, we have to balance it. So which makes the heart to reduce its pumping rate, which will make the blood vessels to dilate, which will make the kidney to release a hormone called as renin. And all these all together makes our body. So this is what is called as our body has its own healing power. So that we have a parasympathetic system in our body, which makes the body, puts a signal into that and balances our body. When the system goes out of this balance, what are the trigger if there is no balance between this parasympathetic as well as sympathetic pathway? What is the one which trigger? So salt, obesity, physical inactivity, excess caffeine, chronic pain, inflammation, chronic psychological stress. What happens? Creates a imbalance in this sympathetic and parasympathetic. If there is a high imbalance, then what happens? The sympathetic overrules the parasympathetic, and there will be complete ruling inside the body by the sympathetic pathway. So what is the research is showing? Higher sympathetic activity is consistently found in people with hypertension. A person who is diagnosed with BP, if we look deeper into their into their autonomic nervous system activity, they have identified that sympathetic activity is higher in them. Reduced heart rate variability, a marker of poor autonomic nervous system balance, is also a marker of cardiovascular risk. Then sympathetic overactivation stimulates the kidney to retain the sodium and water and increasing the blood volume and pressure. So this was already discussed. And stress also intervene the autonomic nervous system balance and causes the, so whatever triggers which we have explained now is automatically increasing the sympathetic nervous system and causing the blood pressure. So restoring the balance is very, very important. How to restore the balance in the sympathetic and restore the balance of autonomic nervous system itself. So we have preferred regular aerobic exercises and slow, deep breathing exercises. We have to improve our quality of sleep, controlling the stress, involving ourselves into mindfulness technique, meditation techniques, yoga, involving ourselves into dietary approaches like increasing the micronutrients in our diet. So the food which is rich in fruits, vegetables, low fat, whole grains, and less stimulants and alcohols. So we should not expose ourselves to continuous stimulations. Then maintaining a healthy weight and staying connected, that is, we have to keep contact with a strong social support every time. So societal talks, societal in conversations, and in continuously having an aware about the day current affairs will help us fight or will help us stay in a balanced state. So breathing, of course, many of the research and scientific papers have found a very important connection of breathing and hypertension. So basically, we can feel our when we try to touch our wrist and when we try to feel our pulse. Okay, that is called as radial pulse. When we feel, if you all are listening now, you can feel your radial pulse in a particular manner. Feel that, and immediately you change your breathing pattern into a deep breathing. What is deep breathing? Deep breathing is consciously breathing or consciously inhale. When we consciously inhale slowly, maintain the breath, and consciously exhale slowly, that procedure is called as deep breath. And when we do this procedure for a period of 2 to 5 minutes and observe the same pulse, the radial pulse in our wrist, we can observe an immediate shift of a rhythm. So, if you have felt that right now, there was a rhythm, and that rhythm will be slowed down. So, we can see or observe now that breathing, breathing technique, especially deep breathing technique, has got an immediate effect on the blood supply or blood pressure in our body or the pulse in our body. So breathe better and live better. Uh, we have in our yoga techniques, so all the pranayama techniques, where we can give a good control in our breathing, but basically we can do the deep breathing to bring a immediate control or immediate, we can say that sympathetic dominance can be reduced and parasympathetic balance can be brought in. So, when you own your breath, nobody can steal your peace. This is an ancient yogic wisdom thought. Whenever you are feeling that my peace of mind is being disturbed or that particular person has disturbed me, shift your consciousness, shift your attention concentration to deep breathing for 2 to 5 minutes. And you can see that you're automatically controlled your body, and you make yourself sure that that person cannot steal your this thing. So here in this slide, four meditation or four pranayama techniques has been mentioned here. So Anlom Vilom, Dirgha Pranayama, Brahmari Pranayama, and Chandra Pranayama. Anlom Vilom is the alternative nostril breathing where we can adopt a Nasigagra Mudra. This is a mudra which is being helpful for regulate or modulate our opening and closing of left and right nostril. Using this Nasigagra Mudra, we can practice alternate nostril breathing. And Dirgha Pranayama is deep breathing or three-part breathing. Brahmari Pranayama is humming bee breath. And Chandra Pranayama is inhalation and exhalation only through the left nostril. So these four pranayamas are exclusively done, can have a good effect on the bringing out a balance in the sympathetic and parasympathetic uh, balance, autonomic nervous system, and turn our body into a balanced state. So calm mind is a healthy, leads to a healthy heart. Healthy heart leads to a happy life. So uh, so this is a guided deep breathing technique for 5 minutes. So we can use the Nasigagra Mudra. Inhale mentally we can count for five. Inhale for 1, 2, 3, 4, and 5. Maintain the breath for 4 count and slowly exhale either through the mouth. Initially, you can exhale through the mouth. Later on, exhaling through the nose will bring about a deep breathing effect and immediate effect on balancing. So all these steps, so controlling our diet, eating healthy, that is focusing on nutrient dense food, uh, using simpler techniques of mindfulness and deep breathing to manage our stress, continuously bringing out a balance in our body, balance in the pumping of blood by staying active and active for 30 minutes a day, maintaining a healthy weight, and sleeping well, making ourselves prepare our body. So sleeping well is very, very important. Not binging and next after completion of next reel or next thing I will sleep, that notion is not towards health. Okay, how we can prepare ourselves? So prepping our bedroom into we say cozy environment, right? So prepping our bed, prepping our body, entering into a cozy garments or the whatever dress we are in, and making an fully dark environment, making a cozy bed, and preparing ourselves, seeing that itself we have to prepare our calm our body, prepare our mind for a sleep. So when we do that, we are automatically reaching 50 percentage of preparation for sleep and preparation for controlling our rhythm. So this, and of course, going no to or saying no to addictions, especially smoking and tobacco, has to be this thing. When we do all these things, so a combined effect of all these is a healthy tomorrow, a healthy artery, a healthy heart, and a stronger heart. Healthy arteries keep blood flowing smoothly, reducing the risk of high blood pressure, heart attack, and stroke. So always keep a healthy or heart healthy checklist with you, and involve in that. Make sure that you are always putting a tick mark to that checklist and stay healthy. Now, this is a cycle where this cycle is showing that we should constantly shift from this red distress cycle into a green wellness cycle. And you can see that always under this cycle of chronic stress, increased blood pressure, sedentary lifestyle, poor sleep, and junk will always lead us to a hypertension. But when we shift ourselves from this distress to a wellness cycle, where we always allow our mind to a calm mind. Mindfulness. Mindfulness is a beautiful topic where mindfulness speaks that when you sit for eating, okay, so when you sit for eating your breakfast, you look into your plate, you identify the different flavors which is there in your plate, you identify different colors in your plate, you use your 5 fingers, you feel the texture of different food. So we will be having different food textures. Some food will be smooth. Some food will be having different textures. Feeling those textures with our hand and taking the food we putting into our mouth, and next level of sensation is we sense through our taste, sensing of our food, we chew our food and eating. So this is a mindful eating. So we are using our all sensory perceptions of view, and of course the smell of the food, the view of the food, touching the food and taste sensation, and having a food is what is called as a mindful eating. And when we do that, we are unknowingly and automatically shifting our stress conditions or continuous stress into a mindful state. And this is what our body is craving for. So, mindfulness, deep breathing, gratitude, then having a nutritious food, having a quality food, sleep by prepping ourselves for a better sleep will always lead to a healthy heart. So, uh, this is all about my speech today, where we have identified the why is there is a need for hypertension, why there is a need because of increased incidence as well as prevalence. What is blood pressure? Why our blood pressure is increasing? We have learned what is a systolic and diastolic blood pressure. What are the things which leads to an increased blood pressure through unhealthy habits? What are all the unhealthy habits we have identified? How we can bring out a change from those unhealthy habits into a mindfulness, into a meditation, into a deep breathing, and choosing our diet wisely, we have identified. But are you still stuck on all these and still stuck on what to choose or what to do, or do you need an assistance? So opting a naturopathy hospital, taking a treatment for your hypertension over a naturopathy and yoga hospital will make you learn all these techniques under a professional guidance and supportive therapies throughout. And each and every naturopathy hospital will be an educational institution which will educate you to a healthy tomorrow. So the JSS Nature Cure and Yoga Hospital, so we are a unit of our JSS Mahavidyapita located at Navakarai, Coimbatore. You can visit and you can experience the varied natural therapies, including diet, yoga, acupuncture, hydrotherapy, including steam baths, mud, and physio, magnetotherapy, and a comprehensive yoga therapy, including yoga practice, meditation, and relaxation. Take treatment here and correct our lifestyle and prevent the disease. So here, the slide have got the details about the specialties, consultation timings, and contact details. You can visit our hospital and identify and get cured. So with this, I conclude my awareness speech on World Hypertension Day. Hope this speech might have instilled an awareness and switched on a thought that yes, I have to move on to a positive health today so that I will live healthy tomorrow. So that's all for today. Thank you so much.
Thank you. I, Dr. Arya, like to express my sincere gratitude to our respected speaker, Dr. Preeti, for sharing such a valuable insights on hypertension, its prevention, and natural approaches to manage it effectively through naturopathy and yoga. I would also like to extend my heartfelt thanks to our respected principal and the management for giving us this wonderful opportunity to organize and conduct this informative health talk sections. Their continuous support and encouragement help us create awareness and promote healthy living among the community. I sincerely thank all the participants and our online viewers for joining us today and make this session a meaningful and a successful one. We request all our viewers to stay tuned for our upcoming health talks and wellness sessions. where we will continue to share more useful information for a healthy and natural way of living. Thank you once again. Have a healthy and wonderful day. Thank you.